stroke patients would have one side paralysis, right? Either right or left. If right side paralysis, left brain would have affected, and left side paralysis, right brain affected. Because the signals come like this, like X. So when one stroke patient gets right side paralysis, he or she would get speech affected, okay, because left side brain has Broca's area, which is controlling our speech, so that's affected. So right side affected, speech also affected. If left side affected, speech will not be affected much. Okay, now you understand, right brain, left side affected. Left brain means right side affected, and stroke comes hemiplegia or hemiparesis. From here, like a line, one side totally affected. In stroke there are two kind. One is hemiparesis, another is hemiplegia. Hemiparesis means partially affected of one side of the body. Hemiplegia means totally affected of one side of the body. Partially affected of one side of the body, really it gets cured very fast with my exercises, my treatment protocols, and which I do offline, also online. I see at least thousands of patients online, stroke patients around the world, okay, from past few years. I would promise 95% of the people totally get cured within 15 days. That too, not like just cure and not able to go work, not like that. They go work back, also they drive two-wheeler, they drive car. It's perfect cure because I teach those kind of exercises. Also I am very patient, also teaching patients until and unless they understand and do it very well. I am teaching in that manner. I am not fast or hurry. So it works very well. How it would be treated online, I will explain you. Stroke patients, first stroke comes, for someone weakness comes, for someone directly total paralysis comes, someone go to hospital and just take medicine and come back home within an hour or 3 hours, someone stay in the hospital for 1 or 2 or 3 days, for someone they will be in the intensive care unit, ICU, that too ICU for 1 or 2, 3 days, ICU for 10 or 15 days also. How it is like this for someone coming back within an hour, someone 15 days in ICU, that depends on the affected level. There are cerebrum, cerebellum, basal ganglion and so much in the brain. It affects which area and how intense it affects, and it's a clot or hemorrhage or these kind of things. By seeing these, doctor decide to keep in ICU or treat him as an OP patient or bed patient. This all depends on that. After finishing those treatments, you go to hospital and come out of the hospital, you will go your home. That is far better. Many stroke patients wants to stay in the hospital or stay in the rehabilitation center for days or months only for physiotherapy. I don't think that is the best method, because patient get stroke due to hypertension or diabetes or some kind of brain affected only. Why they get that? Mostly due to stress they get that, and due to lack of balanced diet and lack of exercise they get that. Again you are being in the hospital, how can he feel better like home? Home is the best place to be stress free. Okay, he has to change his lifestyle from stress to stress free, from stress to happiness, from stress to prosperous and happy life. So for that, he need to change. For that, he has to be in his home. Also, he needs to take very good food, balanced diet, that mostly not available in the hospital. In the home, you will prepare very nicely whatever we tell. So being in the home is better. Okay, in the home there are 2-3 methods to treat. You can come to one clinic and take the treatment. Other thing, you can invite the physiotherapist to come home and treat, house visit. But the third thing is, you can come online, WhatsApp video call, Zoom, Google Meet, or if you are in Dubai, Botim, Saudi Arabia, IMO, or European country, like Google Meet, like this. US means WhatsApp or Zoom. So according to your mobile phone, according to your country, or whatever comfortable for you, and whatever comfortable for me, you can come in that online. First, you can call me and have a detailed consultation, voice consultation with me. Then again, you can send the MRI report and all the investigation discharge summary to me to look that, to have a picture, to make some treatment protocols. Then what happens? Then I come video call and see how the patient is. First, patient may be in flaccid, or totally gone, or hemiparesis, hemiplegia, or little bit movements has come. Lower limb gets cured faster than upper limb usually. So these things I will see. According to that, I will start treating and teaching about exercise, not about exercise teaching in front of me doing. It's same like coming to the clinic or I come to the house. It's little bit better than that, because here I can see very well the patient. Even though I come to home, I cannot go and see very near to his thighs, very near to his hand. But here in the mobile, I can see particularly whichever I want. So I teach him very proper, and totally he gets cured within 15 days if he has hemiparesis, and totally he or she gets cured in 1 month if it is hemiplegia. Sometimes, rarely, 5 out of 100 patients takes 3 months or 6 months if it is hemiplegia. Okay, so in this way I treat them. So I really do so much one-to-one sessions, also group sessions around the world. So stroke patients, don't hesitate to take online from me. Wherever you are in the world, try to call me. Note down my number in the description to have free consultation. Otherwise, I will tell you my website, www.heaven365, heaven, HEAVEN 365 numbers.org. So this website you go, my number will be there, you can touch that, call will come to me. My WhatsApp will be there, you can touch that, WhatsApp will come to me. Our inquiry form is there, you can fill the inquiry form, it will come to me. So in this way, you take online free consultation, then you take paid session, that online session for 7 days, for 15 days, or for someone 1 month. That I will decide, and daily 1 hour, and some patients even morning and evening 2 hours can come. For some patients even morning, afternoon, evening 3 hours can come in front of me. It's totally equal to offline. Believe me, and take this treatment and be healthy. Again, go back to your life. And for free consultation, contact me, and follow me and subscribe me for these kind of health tips. And I am Prakash Physiotherapist.